Good morning, everybody, or afternoon, or evening, depending on where you are in the world watching this today. My name is Mike Warren. I'm with company Alternative Health Concepts, and we are an educational-based company providing information for anybody looking for just that, alternative health concepts, ways that you can heal yourself and help heal yourself, whether it be through nutrition, exercise, any number of different modalities. Our emphasis happens to be on cancer, and we have a product called BioPro Plus that is an immune modulator. And you can go to our website right under my name here, or down in the link and click on it, go to our website and find out all about that. Enough of the commercial for right now. We'll get back to more of that. We have an amazing guest today. I'm really excited to have this lab with our guest, Werner Absenger. He has put together an amazing foundation that helps cancer survivors and caregivers and people undergoing the fight at the same time. So I want to introduce him, and I'm going to do a little cheat on you, Werner, because I know you won't say enough about yourself, and I want to give you the credit where credit's due. You've done some amazing things, and so I'm going to go right to your website if that's okay, and I want to read off your website because I don't want to miss anything. You got some big words on here, so I may get a little tongue twisted. If I do, I'll do my best. But it says that your little bio talks about you're a mind-body medicine research scientist interested in using state-of-the-art imaging techniques and immunological assays, quantitative, qualitative, and mixed methods research to investigate mind-body modalities. As a mind-body medicine research scientist, Werner takes particular interest in cytokine research and the study of the modulatory effects clinical hypnosis, guided imagery, mindfulness meditation, and mind-body skill groups have on the psychoneuroimmunology.
Yeah, Mike.
Immunology. I did really good until that one.
Yeah,
I knew that was and the expression of tumorigenic cytokines in persons living with chronic disease and cancer survivors. Quite a mouthful, but I just wanted our audience, Werner, to get a little bit of the depth of who you are. It's really awesome. I think what you're doing and what little I know about your foundation and what you're doing is we need a lot more people like you if we're going to get to the answer for cancer. And so it's just super exciting to have you here. So with that, I'm going to give you a minute here to tell us your perspective of what you do and what brought you to this place that we're at now with your foundation and what got you here. So tell us your story.
Well, thank you, Mike, for the kind words. And hello, everyone who I can't see, but I know who all of you are out there. So it's very nice to meet you for the first time, or not, if the person who is logging in through one of my links. But so as Mike mentioned, and I'm throwing it out there just this once, I have a PhD in mind-body medicine and a Master's of Science in Human Nutrition. And so I think both of those work hand in hand to bring people whole body medicine, so to speak. So our big focus at the center is integrative medicine. And what we are trying to accomplish really with our programs is that cancer survivors, and we need to define cancer survivorship because many people define cancer survivorship in different ways, and I need to define it how we I need to clarify how we define it. But so what we do is we help cancer survivors. A survivor is somebody from diagnosis of cancer all the way to end of life, whether that is a year, 6 months, or 20 years. So once you have been diagnosed with cancer, for the rest of your life, you're a cancer survivor. And that's the definition we use. Something very interesting also, the National Cancer Institute added friends and family members in the definition of cancer survivor. So that's really big too, because we always forget about the people who take care of cancer patients and cancer survivors in treatment and long after treatment.
Werner, when did that happen? Was that just recent?
I think that was sometime in the mid 2000s when the National Cancer Institute decided, we need to really include family and friends and caregivers into that definition, because research started to emerge that the cancer experience has a huge impact on a cancer survivor's psychosocial environment, and not just the cancer survivor. So
absolutely, that makes total sense.
Yeah. And so our programs then focus on evidence-based mind-body modalities and nutrition modalities that we know have been shown in some setting to help cancer survivors deal with their circumstance. So I'm not saying our goal is to cure cancer, because that's not our job, and that's not what I want to get into. My goal is to help cancer survivors and people suffering from cancer to live as long as possible with the highest quality of life. And there's a big difference, especially when we start viewing cancer from a chronic disease perspective now.
Sure. So give us the backstory of what brought you here. How old were you, and what made you get into that science and that research field that you're in? What brought you there?
So I'm going to make the long story somewhat shorter.
That's fine.
So as you probably can tell, I speak funny. So I'm from Austria originally. I was born and raised in Austria. My parents owned a youth hostel, so I did get in the hospitality business. I'm a trained chef. I did an apprenticeship, chef school, the whole 9 yards. And after I was done with that, my mandatory military stint in the Austrian army, I came to the United States. And there worked in some world-class resorts as chef. And in the early 90s, my dad was diagnosed with cancer, throat cancer. And so this experience threw not only me for a loop, but our whole family. And for those of you old enough, still remember the mid-90s were the emergence of the internet. So dial-up and things like that.
Yep.
So we tried, obviously, everything possible to help my dad. And I was frustrated most of the time by the lack of good information out there. There was quite a bit of information out there, but most of it was dubious at best. And it was really hard to come by really good information. And, fast forward 20 years, the exact opposite is happening now. Now you have so much information, which is really hard to sift through, and even more of it is quite dubious. But what I decided to do was to, use this wake-up call of my dad's diagnosis to say, well, it focused me on my existential issues. So how long am I going to be here and things like that. Mm-hmm. But essentially, it got me off the couch and back to school. And to make a long story short, it led to an undergraduate degree, master's degree, and finally a PhD. And then the goal always was to establish something where we could help cancer survivors with good information to ease their burden of the disease. And really, that's why I'm here.
Wonderful. And so that makes a lot of sense now. And looking at this, getting a little bit of feedback here. You guys hearing that? Okay. Three main parts of your, and I might add that your foundation works in Michigan, primarily Western Michigan, and for right now anyway, for the current time period, people that are going to are from that area because they have to come to your facility and they go through the different integration processes, the education, and even some of the research that you do. So let's get into that real quick. You have three main focus points, it sounds like. that your foundation does. Integration, education, and research. So let's go one at a time. In the integration area, what are you trying to accomplish with these survivors? And
so the integration is, let me back up a little bit and say that most of the listeners here probably are familiar with alternative medicine, complementary medicine, and maybe not so much with integrative medicine. But to really speak to those terms really quick, if you really think about those terms, what do they mean? So alternative medicine really means that you are doing something instead of traditional Western medicine. And complementary medicine, you're doing something in addition to Western medicine. But integrative medicine is really a focus on really focusing on Western medicine and the best mind-body medicine and nutrition have to offer in order to achieve the best outcomes. So integrative medicine is really a model for whole person care. And most people would agree with that. So when we talk about integration, my goal it is, I'm not a medical doctor, but my goal is to always encourage survivors to work with their medical doctors and their oncologists to incorporate as much as possible from the evidence we have from mind-body medicine and nutrition. So some doctors are really open to it. Some doctors are, unfortunately, not quite that open. And because they're really protective of the patients, and we already covered, there's a lot of dubious information out there. But really, that is the essence of the integration part. We want to bring the best possible evidence-based information to our clients and patients so they can make informed decisions towards the healthcare. That's really the integration part.
And with that obviously leads into your second focus point, because what this is all about for anybody that is facing cancer, whether they be a caregiver, and I like the way that the new kind of definition is we're all survivors, whether we're caregiver, family member, or the actual person that has the cancer. I really like that because we're all in that together. Is the education process, and it is, as you mentioned earlier, there is so much on the internet. You get that diagnosis, and it's got to be an automatic. You go into fight or flight mode. You go into panic mode. It's scary. We all have friends and relatives that have passed from cancer. So when we're looking at that, it's it can be awe-inspiring, but it also can be really depressing. So the education process of what you're doing and educating people that, number one, death sentence, it's not a death sentence. It doesn't have to be a death sentence, but you have to learn about it. You have to understand what cancer is and understand the root cause and help get your immune system back in order so that it can fight the cancer cells and kill them. So then that takes us into your education process. So what do you do there at your facility as far as educating people?
So let's start with our blog, which is, accessible to, a worldwide audience. So I'm not writing as much as I should be, but I really enjoy pulling information from many different sources. And in my case, it's, again, peer-reviewed journals, and try to really write about what might matter to our client base and how our clients might benefit from, let's say, meditation, music therapy, yoga, what have you. So this is what we are really trying to do with educating. We are trying to educate people. We understand not everybody wants to get up and go to a yoga class.
Sure.
Not everybody wants to go to take a meditation class. But what we understand is that people are searching for something, what else they can do in addition to what they're already doing. And that is especially prevalent once survivors get into the non-acute phase of care, meaning they went through the treatment and the oncologist says, okay, you're good, I see you in a year. And then all of a sudden, there is no more contact with the or not as much contact with their primary care physicians as there was before. And now survivors might be thrown off a little bit. And they go, well, what else can I do? What can I do nutritionally? Should I exercise? Should I drink this? Should I eat that? So our aim is to bring good information to them so they can make educated decisions. And that's where the education part comes in. We say, so we offer meditation, music therapy, yoga, mindful eating groups, because the evidence suggests that if you do that during survivorship, your quality of life will increase, and most likely you will feel a lot better. And with feeling a lot better, obviously you're motivated to do more things. And when you're motivated to do more things, you go do your follow-up things and checkups. And so you stand a better chance of really discovering reoccurral of cancer before it becomes a major problem.
Absolutely.
So really, it's a whole cycle. So what we aim to do, the education part, is really aiming to keep a cancer survivor in the continuum of care, if that makes sense.
No, absolutely makes sense. So that takes us to, and I'm assuming these are fairly much in order, but to your research department. Now, you mentioned, or you touched on, studies suggest that if you do these things, music, all the mind-body techniques that you've researched, that those will help, obviously, and it'll help your quality of life, and it'll actually help you overcome the cancer, I would assume, in a lot of cases. So let's talk about some of the research that you've done that maybe you're working on now, and how you integrate that back into this foundation, and how that helps the people that you're dealing with. Okay,
so there is three major research projects I'm trying to, I either worked on or I'm trying to get off the ground. So the first one, let's talk about our research with breast cancer survivors and medical hypnosis and interleukin-1 beta, which is one of the cytokines, which indicate immune system function. So last year we concluded a research project with 20 breast cancer survivors where they came in and they were randomized to either a medical hypnosis group or a white noise sham hypnosis group. And so we assessed the participants' hypnotizability and things like that. And so, to make a long story short, at the end of the study, after all the data was in, we could show, or the data showed, that depending on how hypnotizable you are, you actually can affect your immune system with a hypnosis session. And the interesting part was that it didn't matter whether it was a spoken script through medical hypnosis or a white noise sham hypnosis session. And that was the surprising aspect of the study, because...
So let me stop you there real quick, because a lot of our listeners, and I don't know the difference. What's the difference between a white noise hypnosis session and a medical hypnosis session?
Okay. So when a person comes to hypnosis, we hope that the conversation we have with the person before, during, and after hypnosis will somehow affect a person's health. And there's, again, pretty good research out there that it does. But on the premise of white noise sham hypnosis, which is simply white noise under the disguise of a hypnosis session, it was really my control group to see if that would have an effect on the immune system. And interestingly enough, so without any instructions from anyone, simply by me telling a participant, so you'll receive white noise hypnosis, and there's some frequencies embedded in the white noise, which will help you get better and look out for those, or try to pay attention to those frequencies, which there wasn't really any frequencies embedded. So it's all under the disguise of a hypnosis session. And so we found that highly hypnotizable participants actually responded really well to white noise sham hypnosis or the medical hypnosis. So now that, of course, presents challenges, because how is this possible? So one of those aspects is that we think that how a person comes to the office already under the premise of expectation. So in other words, if you come with an expectation to get a treatment that will make you better, it actually will work, whether you get the treatment or not. So we're talking about the placebo effect, really.
Sure.
So that was an interesting finding. And the other interesting finding was we speculated that because from the data, the results should have shown that interleukin-1 beta would decrease due to the hypnosis session. But it actually did increase in highly hypnotizable participants. So again, we had to go look through the research and see what that might mean. And what we really discovered is that there might be two aspects of stress at work, chronic stress and acute stress. And we're still trying to make sense on how that might play out. But that's the gist of the hypnosis session and the hypnosis research.
And this was with breast cancer patients, particularly?
It was 24 breast cancer survivors, and mostly older women, but there was a couple of young women in the group as well. But I think the really fascinating part about that research, again, is that highly hypnotizable people, there was a significant change in interleukin-1 beta, which is an immune system biomarker before hypnosis and after hypnosis, and simply based on the premise that we're doing something that will make your immune system work better.
So you do that through blood? Is that how you test
actually,
the survivors?
It was saliva. So interleukin-1 beta, what we did was we took saliva samples pre and post, and we sent them off to the lab. And it's not very messy. It's pretty clean. It's considered non-invasive. So it's really, it was the right thing to do for this type of research.
That's fascinating to me, actually. So now you've got that research compiled. Do you publish your paper at that point, or do you just use it within your foundation to help more survivors?
We are still working on publishing it. So peer review publication takes some time. We are trying to find a good fit of a journal where we can speak to the right audience.
Correct.
And our audience, I think it would be the medical community who deals with breast cancer survivors. So we're still searching for the right peer-reviewed journal to publish that, and then obviously for them to say, well, yes, we are interested in even looking at it and for it to go into peer review. So we are doing that right now. And then you want me to still talk about the other two research projects?
Actually, I'm fascinated by it, so please.
Okay. So the second research project, which is just coming off the ground, and I'm working with a young grad student, and she expressed an interest in yoga, and she is saying, well, what's the literature on yoga and what can we do? And obviously yoga is pretty well researched in breast cancer survivors, but really what I'm interested in, and my wife is a yoga teacher and she teaches a lot of chakra yoga. I'm really fascinated by chakra yoga and the premise that energy centers in the body can somehow make you healthier or worse, depending on how they function. So with this young graduate student, her name is Ashley, we are developing a protocol, a yoga protocol, where we are again trying to figure out how to best assess, how do you measure energy and change of energy in the body. And also, how do people respond to chakra yoga, like from a spiritual perspective and also from a wellness perspective? So we are looking at, again, salivary cytokines to assess those. We are looking at several assessments of spirituality. And the last assessment we're looking at is like fascinating. And we are still trying to come to terms on how to really do that. And we're trying to investigate gap junctions, really.
What was that? What was that?
Gap junctions.
Okay.
And now you want me to explain what that is, right?
Yes, I do.
The very premise of energy medicine, or when we talk about energy medicine, or let's back up, let's talk about cells. So we think that cells are packed tightly like this, right, in the body. Mm-hmm. So, but cells communicate from one to each other, right? And so how would cells be able to communicate from your gut into your brain, right? Other than affecting other things. But from acupuncture research, we know that there might be something else in place, and it's called gap junctions. And gap junctions are actually, people are looking at it in chronic disease and cancer research. But a gap junction, so when cells, and I'm going to turn this over so you get a better idea. So when we talk about gap junctions, if cells are packed like that, there is no way of information to pass from one cell to the other. But when a gap junction forms, all of a sudden, there's let me see if I can illustrate that. So all of a sudden, there's a little hole like here. Mm-hmm, mm-hmm. And the hole would go from one cell to the other cell, to the next cell, to the next cell. So in essence, a gap junction where cells would align perfectly for the gap junctions to align and information to pass through the cell. And an example I could draw of is like when you look at the International Space Station and the spaceship docks to the station, when the door opens, then, the gap junction is open.
Gotcha.
And so when it's perfectly aligned, information can flow through.
Nice.
And what we think, there's some, and most of that research is strictly theoretical at this point, but people think that our spinal column, there's some remnants still from when we first developed, and gap junctions are one of those things that still could be playing a part in energy to travel large distances. So that's really the gist of that research.
That's exciting. I would assume that with that last statement that you just said, you probably have a lot of chiropractors looking into that same area with the spine and the nervous system.
Yeah. And it's really exciting because gap junctions are something that's just emerging even in mainstream research.
Yes, excellent. Exciting.
And and then the third project is because our focus is not just helping people, even though our focus is specifically on helping people with cancer, but many things we do, there is pretty good evidence that it might be applicable for other chronic diseases as well. So the third research project I'm currently working on with Teresa and Pedro is another hypnosis research project where we're trying to investigate if medical hypnosis or hypnosis can be effective in people who are deaf, like who can't hear.
Yeah.
Because that population again is suffering from health disparities. Their access of care is limited because they can't hear. So, but we know from research that hypnosis might be really effective in pain management. So we want to expose deaf people to hypnosis via American Sign Language to see if American Sign Language, if somebody can, one, be hypnotized with American Sign Language, and then two, if you can hypnotize them in a way so it would actually have an effect on a person's pain outcomes.
That's exciting. Real exciting. Yeah. We have a question over here, Werner. They ask, could you recommend a peer-reviewed journal that has studies of the types of treatments you mentioned or are open to more holistic methods. And that's probably, there's so many journals out there, I don't know if there would be one that you would recommend or.
So there's actually many journals out there who publish quite a bit in mind-body medicine and nutrition. The British Medical Journal, BMJ, is a very good source. PubMed, if you go on PubMed, it's an excellent source where you can go and just type in a search term, like, for example, pain management and hypnosis, and then it will bring up studies who were published on the topic, and then the link will bring you to the peer-reviewed journal where it was published on.
Yeah.
So those are excellent sources, and it's that information is becoming widely. Well, I can say widely because peer-reviewed journals like to hide the journals behind a paywall. But there is one excellent journal out there, and you don't mind if I putz around really quick looking for something?
No, absolutely. Go ahead.
Let me do. There is a publishing corporation out there, and I'm going to post a link.
Perfect.
It's called, I go to the right-hand bottom side, yeah?
Yeah, just where it says send a message, and you can type it right in there.
So if you go to hindavika.com, you should have access to many peer-reviewed journals which are open access, which means you don't have to pay for the full article. You just can go on there. And so you just look for their open access journal that deals with mind-body medicine or nutrition, and you get a lot of good information from the journal.
Awesome.
So that's just one. Yeah.
Yeah, I appreciate that particularly. We do a lot of research ourselves, not the kind of research you're talking about, more researching reviews and trying to understand how we can better strengthen our immune system. That's what we do at Alternative Health Concepts. And
right.
So
let me you don't mind if I give you another resource, right?
Absolutely. The more resources, the better. That's what we're here for, and we love that because that's what we end up sharing with people that are watching the replay of this, and that's what most of our people end up doing because people are at work right now or whatever the case may be. But so not as many people watch this live, but the replays are where they get it.
So I'm giving you another resource, which is at Harvard University, and it's the program of placebo studies. It's fascinating research that's coming out of there. And there's a couple of guys there who say, Erwin Kirsch, he just published a paper last year or a year ago where he said, or where he tried to explain that you don't really have to hide a study under the disguise of placebo. He published research where he did research. He told participants, you are going to be receiving a placebo. And they still responded. Wow. So he didn't even mask the placebo, which is really fascinating because people knew I'm getting something that technically should not help me.
Yeah.
But yet they responded to it. It's fascinating stuff.
What do you contribute that to?
So
I know you didn't do the research, but is it energy?
I don't know so much about energy, but I think Kirsch, for example, he talks a lot about expectancy. So if you set yourself up to expect a certain outcome, you're increasing the likelihood for that outcome to occur. So buyer be aware. Be careful what you wish for.
Yeah, well, not only that, but that's so important for somebody that is a cancer survivor because that getting that mindset that you're going to be whole again or you're going to recover from this cancer is so important. And a lot of people, and I include myself, but even doctors in the medical community forget how important the mind-body aspect of any chronic disease is. Our bodies are amazing tools, and they're perfectly designed to overcome any of these obstacles that we face in chronic disease.
Yeah.
And the mind plays probably one of the major portions of that, or the most important part, maybe, I don't know.
Yeah.
But, so and that's what I liked about what you're doing, because you focus on that mind-body aspect of healing, and you get your people involved in that, and your survivors come to you and work from all aspects of that. You don't look at it as a one fit fixes all, because there is no such thing as that. The way I look at
it. It's impossible. And so, can I mention our program we're just about to start, which was funded by, I don't know how many are here from overseas, but there is a major nonprofit organization in the States. It's called Susan G. Komen, and they do a lot of things for breast cancer survivors. And so I just wanted to mention our research project, not research project, but our program we are about to start, which is a year program starting April 1, and it goes to March 31st, 2017. It's called Living Well in Breast Cancer Survivorship. And so what it is we are targeting low-income breast cancer survivors in a county that's ranking at the bottom in health outcomes in Michigan.
Wow.
And we are hoping to expose them to yoga, meditation, music therapy, mindful eating, and survivorship care plan counseling. And so those are the modalities which we're really excited about, and which we think if breast cancer survivors come regularly, they will have a distinct benefit and their life will improve based on the research we have.
Thank you for sharing that, Werner, because to me, that is what you're doing that makes this so fantastic. You're helping those that are less fortunate than a lot of us, that don't have access to these things in a lot of cases. And to do that is just, it's above admirable. My hat's off to you, and I commend you for what you're doing there, and I'm excited to see the outcome, because we need more of that. It's not just a disease of the rich or the poor. It affects all of us, but unfortunately, the poor are less able to get some of these modalities that they desperately need. So that's super exciting to me.
Well, thank you for the kind words, but actually, again, there's a reason why we are targeting low-income persons, because they carry a burden of the disease which is higher than people who from well-to-do socioeconomic circumstances. So, and it might not be that grave of a difference in Europe because of universal health care. But so for those of you listening in Europe and the United States, we have a healthcare system which, if you have money, then it appears that you get better healthcare, even though it's not intended to do that. But wouldn't you agree, Mike? It's one could say that if you have more money, then you have better access to care.
Absolutely. I don't think there's any question, particularly here in the United States. I've never lived anywhere else but the United States, so I can't speak to what they have in Europe or Canada or anywhere else in the world. But I definitely have seen that in my own life. And the interesting thing about that, it's almost a dichotomy, if you will. If you have super good health insurance, sometimes you're overprescribed things that you don't really need, because the doctors are able to bill for it, and you might get 30 different tests when you really only needed one, but you had great insurance, so an insurance paid for everything. But it's all different aspects of looking at it. But definitely agree with you, and as a rule, the more wealth you have, the better health you are able to access. And we see it constantly, and I think it's the people that fortunately, there's some great doctors that are willing to do things at clinics that have the best intention and help people, whether they have money or not. They're in it. They're not in it for the money. They're in it because they really care for the individual or for the human, and that is what that's what's amazing about all of this. We're all in this together, and what you're doing is again, it's admirable. I really appreciate it. I agree with your point.
Thank you. I'm trying to look for another resource, and I might not find it, so I might have to send you a link to it because I always forget the name of it. And the moment we get off the phone, I will remember the name of it.
Yeah, no, I know how that goes, believe me.
It's, okay, let me find it. I think I remember the name of it. I had a lightning struck.
It's fun when that happens, isn't it?
So there is a movement, and I'm just going to send you the blog, and listeners can discover, much more research on their own. But there is a movement in the medical community that actually holds the philosophy that less is more medicine.
Yep. That's kind of what I was getting to about.
Yeah.
Sometimes it really can be. I agree with that in some cases.
And exactly, in some cases, and doctors are concerned about, because our technology is getting so good now that we are discovering, for example, I read a little bit about cancer and less is more in medicine, that they can discover cancer before it's really a cause of concern. See where I'm going at? So you go to the doctor, they do a test, and they come back to you and say, you have cancer. But the gist of it is that you have cancer, which might or might not be cancer, and it might or might not be treated. But just to be safe, we're going to do some more tests. Just to be safe, we're going to, take tissue and things like that. So all of a sudden, you're exposing a patient to unnecessary testing because the cancer probably never did grow all the way, or because the patient was that old, like, for example, in prostate cancer, like if you have a really old man and you discover prostate cancer, then it becomes, or you discover, there might be a possibility of prostate cancer. Then the issue is no longer should you treat the cancer, but the issue is, is it ethical for you to treat the cancer? Because would treating the cancer actually do more harm than good for the rest of the person's life? It gets complicated, and obviously, there's people out there who say, well, if I discover cancer, I would do anything possible. And yes, I agree. But again, are we doing more harm or more good? So that's what this discussion is about, less is more in medicine. And there's some excellent blogs and websites out there. And the National Institutes of Health in Bethesda actually has an annual conference just on that topic, where concerned doctors are gathering and saying, what are we really doing here? And how can we make the situation better? So it's pretty fascinating.
I had another question for you, Werner. Do you offer any phone or Skype consultations for those recovering? I'm assuming they meant survivors, not in your area.
I can. To make a long story short, just go to our website, click one of the contact links, shoot me an email, and see if I can help. And we'll see if we can help you via net or Skype or whatever we might use.
Yeah, I think you and I talked about that briefly the other day when we were getting together in preparation for this. And it's something that it sounds like maybe in the future you're going to definitely entertain. Right now that you're dealing with the physical aspect of the survivors and where they come to your facility and they learn these, they have these classes. You have wonderful classes, it looks like, about nutrition. And you as a trained chef, I assume that you do some of the coaching there.
Yes, the Mindful Eating group, I teach that.
Awesome. And
people
I
get really.
so you probably have some wonderful recipes and those type of things that you've come up with that help.
So I just wanted to throw out one more thing
Okay.
based on the consorts, the internet consorts. And I also collaborated on a study last year with a colleague of mine. Her name is Chanel Hierman, and she's a psychiatrist. And we actually did and Jerome Saris from the University of Melbourne, I think it is. So we collaborated on a research project where we took a mind body skills group, which is a 6-week group where people come once a week for 2 hours, and we expose them. We tell them a little bit about the science. We expose them to meditation, how does it work, and now go home and practice for a week. To make a long story short, but we collaborated on a study or on a research project where we actually had participants come to a patient center in Colorado. And again, it was mostly low-income persons. So they came to the center in Colorado while Chanel was in a different space somewhere else in Colorado. And so she administered the Mind Body Skill group via telemedicine or via video and Skype.
Right.
And so the findings of that are that we didn't take any, biomarkers or anything like that, but we just wanted to find out, are people responding well to that type of intervention? And it looks like people are really open to this type of intervention. And I mentioned one more colleague of mine, Alex Baker, who is a sex therapist. Her and I work together on sexual issues of cancer survivors, but she says, or her experience with counseling people over internet or video conferences, that it's actually better for them because they're in their own home, their own environment, and they feel safer there.
Absolutely.
And that's a big one for her when you start talking about a touchy subject like human sexuality.
Absolutely. But boy, it's such an important subject with survivors, because it that's where it affects the rest of the family, their mate. It is really an important subject.
Yeah, and again, it's about addressing the need of the whole person, not just a person's parts and tissue, whether or not there's cancer in it or not.
Correct. Well, we're almost at the top of the hour. I know that you've got a tight appointment scheduled, so we want to get to the end here. Is there anything? First of all, let me thank you as we wrap this up for coming on. I'm just so excited about what you're doing. We're gonna possibly, as we talked, maybe do some collaboration ourselves between our companies, and I look forward to that and talking more about that. But what would you say to the person that is out here that may be listening to the replay, that just got the diagnosis of cancer? What would you tell that person? Where do they need to start? What do they do? Because that is a world of confusion, and you can go so many directions. Where would you tell that person to start in their journey of fighting cancer?
I hear you. So, first of all, it's been great being here. So thank you for having me, Mike. And I'm definitely looking forward to, whatever might comes,
Absolutely.
Whatever happens. But to the person, I would say, one, the big C is no longer a death sentence for most parts. Only in the most, unfortunate circumstances, do you really get a grim diagnosis. But for most parts, the big C is no longer a death sentence. So that's the first thing. The second thing, there's going to be a lot of emotions involved you have to deal with. And dealing with those emotions by yourself leaves you open to making not so good decisions for yourself. So my second advice would be to find one trusted person who you can collaborate with and who will be your spokesperson no matter what. And that spokesperson can be your husband, it can be your wife, it can be your child, find somebody who cares as much about your health as you do, but can distance themselves emotionally from that. Does that make sense?
Yeah, absolutely. I think that's so important, particularly when you're talking about cancer. You can go so many different ways, and unfortunately, it's mind blowing. I mean, it ruins everything, and particularly for the person that gets that diagnosis, they are, like you said, their emotions are going everywhere. They're going. A case of a good friend of mine, they're going to. Am I going to be able to even wear this dress that I just bought next year to this party? Yeah. Their mind goes right to the worst case in a lot of cases. Yeah. And so to be able to do that, I think that's wonderful. And having an advocate for you so that you can speak, that will go with you to your doctor appointments, that will question the doctors on your behalf, because your mind isn't where it needs to be in that case.
And that's absolutely correct. And that's the big thing. Even if you go to the doctor, you have your trusted person with you, because they are going to be able to hear the information in a totally different way than you're going to hear it. Yeah. And like Mike mentioned, most likely you will hear everything your doctor tells you in a worst case scenario, where it's not necessarily so. And that's where you need your trusted person or caregiver or whatever you want to call them.
Yeah.
And third of all, I would encourage you to seek also professional help, not just your oncologist. Again, I encourage you to work with your oncologist. Find an oncologist that is willing to work with you, willing to discuss everything. Those are the people you want on a team. But also find somebody who is able to address your psychosocial issues of the disease. And so that will help you in the long run, especially as you go through treatment. And once your oncologist tells you, "Oh, I'm done with you," I have done all that I can, and I will see you in a year for a checkup. Then you have to have a social network or a psychosocial environment where you can ask the other questions. So what do I do now? Should I do nutrition and things like that? So start early in the process, because then you are set up for the whole journey and for the long haul.
Sure. Absolutely. So would you, with that, what you said right then, as soon as you get a diagnosis, obviously you're going to be working with an oncologist in most cases. What are some of those other areas that you would look to for help? So I would imagine, obviously, the obvious would be foundations such as yours, but right. I haven't seen a lot of those around. And what else? What other kind of areas would be good for people to look at, or resources where they look at? Obviously, there's some really good ones online. We have a lady in our audience right now that has a wonderful website. It's called the Anti-Cancer Club. She's a cancer survivor, and she's more than welcome to take a seat if you'd like. I know that you just dropped in, but there's some really good sites online that people can get involved with. Is that what you're talking about there, Werner?
That's what I'm talking about, and I'm also talking about. So most likely you will get treatment at a bigger cancer center, or a major cancer center. Inquire about their navigation services. And what I mean by that is that many of those centers have a nurse navigator who will specifically address any and all questions you might have. Now, there's one caveat, and that is most likely they will have not so much information about mind, body medicine or nutrition, but a lot of good information of what you can expect, where to find other resources to deal with what you have to deal with, like, for example, getting rights, getting financial help, things like that. So most certainly ask, should you be in the unfortunate position to have a cancer diagnosis, before you even walk out of there, ask, where's your nurse navigator? And get her card or her phone number, and just so you have somebody to get in touch with saying, okay, what are my options? And nurse navigators, they are excellent people. They really know their stuff, and they really have connections in the community they can connect you to based on what you're looking for. It'll save you a lot of running around.
Just for my own information, is a nurse navigator, would that be equivalent, or is it, I hear about cancer coaches and having a cancer coach. Is that kind of the same thing, or are those different in that area?
It is my understanding that that's different.
Okay.
Because the nurse navigator's job is to find you the cancer coach.
Okay, excellent. And that's somebody that will walk you through some of these other areas like we're talking about, the mind, body, the nutrition, all those factors that are very important that, quite frankly, not because they don't want to, but probably because of time issue, your oncologist may not be able to go into a lot of those areas.
And that's just it. I gave an excellent talk. Well, I don't know if it's excellent, but the feedback people gave me was that it's excellent. But I have a talk where I talk about healing is not curing, or healing does not equal curing, or curing does not equal healing. Yeah. And we actually addressed that in the talk quite a bit, that your oncologist plays a totally different role on your healthcare team than, let's say, a person like myself would play. My job would be to help you heal. Your oncologist's jobs is to cure you, or to try to cure you.
Sure.
And many oncologists will say, well, that's in many cases not possible. But from the way Western medicine is set up, oncologists are experts in really dealing with every issue of cancer, and they will try everything possible to cure you of cancer, be that with chemo, be that with surgery, whatever. And you don't want to dismiss what they know about it based on, oh, they're poisoning me and things like that. You totally don't want to dismiss that. But then you also have to think about how you heal as a person. And if you can combine those two, like in integrative medicine, I know we see better outcomes in cancer care.
Absolutely.
But that's a different blab.
Well, yeah, it is. And maybe we could venture into that next time. Thank you again for coming, Werner. Really appreciated it. If there's anything we can do to help you promote or do anything, like I mentioned to you, if you want to do one of these blabs, I'd love to have you help you in any way we can, and personally come on and help you do that. Thank you so much for being here. Really appreciate it. For all those you listening to the replay or watching now, go to our website, Alternative Health Concepts, at the address right below my name, and check out what we are offering you. We are about building your immune system so that you can heal yourself naturally from any chronic disease. We believe that the basis for any healing is your immune system. And if you can get your immune system optimal like it once was, you'll be able to overcome your chronic disease. Werner, thank you again so much for being here. Really appreciate it. And we'll catch you soon.